Preterm Labor by Logan Dameron at East Tennessee State University. The definition of preterm labor. Preterm labor is labor that is between 20 and 37 weeks gestation. Preterm labor consists of regular contractions of the uterus that results in cervical dilation. The statistics of preterm labor. Preterm birth currently affects 1 in every 10 infants born in the United States. About 12% of all pregnancies experience preterm birth. Preterm birth has continued to rise throughout the last 2 decades. Racial prevalence of preterm labor. In 2016, the rate of preterm labor in African American women was 50% higher than the preterm birth among white women. Non-Hispanic Black infants' mortality rates due to preterm deliveries triples the mortality rate of non-Hispanic white infants. Risk factors for preterm labor include the patient having a previous preterm delivery, the patient having a short cervix, substance abuse such as smoking or drugs, short interval pregnancy, African American, infections of urinary or genital areas, sexually transmitted diseases, chronic conditions such as diabetes, thyroid issues, or hypertension, and if the patient is pregnant with multiples. This slide indicates pictures of risk factors for preterm labor. The ultrasound is a patient pregnant with multiples. The other pictures of pregnant patient smoking, which increases her risk for preterm labor. And the last picture shows social, personal, and economic characteristics, pregnancy and medical conditions, and behavioral issues that lead to preterm birth. Some of the symptoms of preterm labor include regular contractions, low backache, mild abdomen cramping, premature rupture of membranes, vaginal bleeding, or an increase or change in discharge. It is very important for the healthcare provider to assess risk factors and symptoms of preterm labor at each visit with each patient. There are many ways to diagnose preterm labor. The patient can be placed on a non-stress test to assess for regular contractions. The patient could have an ultrasound to assess for fetal position. The patient could have a pelvic exam to assess for cervical dilation. The patient could also have more testing to assess for an infection such as an UTI or STD. It is important for the physician to assess for membranes, if they are intact or not. It is also important to assess a fetal fibronectin lab test. Treatment measures for preterm labor includes a round of corticosteroids to help enhance lung maturity in the infant. In case of a delivery, tocolytics are available to help stop contractions if clinically indicated, and magnesium sulfate is available to help prevent cerebral palsy in the future for the infant that is delivered early. Long-term health conditions with a preterm infant include cerebral palsy, impaired learning, vision problems such as retinopathy, at risk for hearing loss, dental problems, behavioral or psychological issues, and chronic health issues such as asthma, feeding problems, at risk for infections, and a higher risk for SIDS. To help prevent preterm deliveries in the future, we need to encourage these patients to regularly follow up with their healthcare provider. We also need to improve patient to provider communication.